Hi, everybody. My name is Trent Wehrhahn. I'm with SmileShop Dental Marketing, and today I have the pleasure of talking with Chelsey Ironside from EMS, and we're going to be talking about a topic that I'm excited about, which is GBT. Welcome, Chelsey. Why don't you tell us a little bit about yourself?
Yeah, absolutely. Thank you for having me. My name is Chelsey Ironside, and I am a GBT expert. That stands for Guided Biofilm Therapy. I'm a registered dental hygienist. I've been practicing for 19 years. I'm based out of Edmonton, and I use the technology and the GBT protocol that we're going to talk about today in my practice for 4 years. I then became a trainer on the technology, and I trained other clinicians on how to use it and how to implement it into their practice. And I was fortunate enough to move into the role as a GBT expert in February last year. Because it is growing so immensely in North America, they needed someone to move into the role that could support clinicians and dental distributors in implementing this technology and ensure successful implementation of guided biofilm therapy into their practices.
Okay, awesome. So if it's okay, I'm just going to ask you a few questions, and I'm sure you've got some questions to ask me.
Absolutely.
So why don't we just get into that, and we'll go from there. So I guess if I'm a dentist, I'm probably wondering, why would I put GBT in my practice versus some other new dental technologies?
Yeah, great question. I find that when we look at the history of dental hygiene, the way that we've really been doing it has been the same since the introduction of dental hygiene, with maybe a few changes or some shifts in how we're doing it. But when we look at dentistry overall, it's evolved immensely, and the technology has evolved immensely, especially on the side that supports the dentist and what they're doing in terms of restorative or implant placement and things like that. But how we're actually offering the treatment for patients hasn't really changed that much. And we know that that is a really important piece to a patient's overall health, but obviously also supporting, the dentist in the work that he's doing. We want to make sure that we're supporting and cleaning all of the surfaces properly. But a lot of patients don't like coming because they find it quite traumatic. It can be very sensitive. It can be a little bit intense with the traditional tools that we're using. Many of them would call them picks or scrapers, or how much are you going to scrape? Or there's the ultrasonic, which can also be very sensitive for patients. And so guided biofilm therapy is really about shifting the practice and how can we make it a more comfortable experience for patients, but also make it a really efficient delivery of debridement for the hygienist as well. Because it is so hard on a hygienist's body, we want to give them tools that are going to be also comfortable for them to use. And we can go into a little bit more detail about guided biofilm therapy and specifics, but that's really ultimately what we're trying to do, is shift to a more preventative model and a more comfortable experience for patients.
Okay, well, I can vouch for the comfortable experience. I've definitely had that, and I won't go to a dentist who doesn't have it now. But why don't you go ahead and ask me something?
Yeah, I would love to actually know, for obviously you're coming from experience on the marketing side with dentistry, but why don't you share a little bit about your experience as a patient with guided biofilm therapy and what you found was different for you, and maybe how you felt as a patient seeing a practice that invested in this technology to support your experience.
Well, first off, my dentist got GBT because I asked them to. And that's what happens when you're in marketing, right? You learn about new technologies and you realize, wow, I want to experience that. But when I actually had the chance to experience it, one of the things that really bothered me was the older ultrasonic tools. For a couple of reasons. They get caught in my front teeth. But the worst was when they got to the back, it vibrated in my head, and I just couldn't stand that. What I found with GBT is that it's very comfortable. I find that my teeth feel cleaner afterwards without being polished, which is amazing. It's just an overall better experience, and it seems quicker too. I'm not sure if that's actually the case, but it does seem like I'm in and out of there faster, so maybe it's faster.
Yeah.
How long has GBT been in Canada?
Yeah, so GBT itself, with the technology called the Airflow Prophylaxis Master Device from EMS, which is the company that makes the technology, has been in Canada since 2017. So we've been here actually for quite a while. It has been established in other markets globally for quite a bit longer than that. And what's interesting about it is the protocol or the philosophy behind this came really before the technology did. And EMS is the company that sort of stepped in and said, you're right, we need to do things a little bit differently. We need to evolve our preventative practice and our prophylaxis, which is the term used in a lot of the global market for hygiene therapy. And here in Canada, we would probably say hygiene appointment, or many people would say cleaning. So it's been around a long time. And what's cool about it is it's evidence-based and it's research-based. So this all came about because we knew so much more about how the oral cavity and the health of our mouth really does impact our overall health. And I think dentistry's always been kind of at the forefront of prevention compared to other areas of medicine. But now we're really just pushing that boundary where we know that there's a lot of, I guess, power in prevention. And I think probably you could speak to it in terms of the profitability of prevention as well. And that's what we want to move towards. And so it's been well established in Canada, but it continues to grow. And I think a lot of people are still learning about this shift that we're making in hygiene visits.
Yeah, we've seen more and more practices coming on board with it. So that's excellent. And I think that's important because I think anything you can do to market your practice that differentiates you in any market. The dental market in Canada right now is so competitive. Like there's just so many practices. Every time you turn around, there's another one showing up. And I think something like GBT gives you the ability to say something different than everybody else out there. And in a way that it actually positions you as a premium service, because I think that it gives those who are getting the service, there's no additional cost in most cases, unless some offices are upcharging. I don't think so, but in my experience, you get a lot better or a lot more comfortable time at the dentist with no extra charge. So why wouldn't I want to do that, right? And I think the other thing that I'm excited about it is the practices that have it now. He who speaks about it first wins, right? And I think back to the early times when I was marketing dental practices, and there was one practice, I won't mention their name, here in Calgary that talked about sedation. Sedation was relatively new there then, and they talked about it a lot. They were on all the radio stations, they did direct mail. Every time you turned around, you could hear them talking about sedation. And even today, if you say, who's the sedation dentist in Calgary, everybody will say their name because that put them at the forefront. So that excites me when somebody has a new technology that we can talk about first, right? So let me ask you this. What is the aha moment that patients typically have when they're starting to get GBT? Is it like, oh, this is different?
Yeah, absolutely. And I think that's what's so important for EMS as well, is that we're really passionate about the education side of things. So we do 6-hour hands-on training with clinicians when they introduce the technology, because a lot of that is actually also introducing it into your patients, because they're booking whatever their 3, 4, 6 month hygiene visits. And for 40 years, they've been coming and it's been essentially the exact same with maybe a few small changes, a new polish flavor paste or new fluoride flavor. But it's been kind of the same. So all of a sudden when they come in, and it's cool because clinicians get really excited about it too. And when patients see how enthusiastic clinicians are about now the technology they have to make it a better experience for them, I find patients get kind of reinvigorated about their experience and also their participation in their overall health too, right? And I would say overwhelmingly, we actually do a lot of patient surveys out there. That's one of the things that we have clinics do, because we want to ensure that they're getting a good experience. And overwhelmingly, I think we have over 400,000 surveys that have been collected worldwide. We're probably higher than that now, that 94% of patients prefer guided biofilm therapy over the traditional model. And I I feel like for many of them, it's just that, wow, finally. Finally, we've come to a place where this doesn't feel like a dread. Even patients who don't have anxiety or don't have maybe trauma from previous experiences, everyone still has that little bit of discomfort or stress about coming into the dentist office. And it's really a different, a more relaxing experience for them.
But can you expand on that and just maybe explain what is different about GBT than traditional hygiene therapy?
Yeah, absolutely. So it's an 8-step protocol, and a lot of the beginning steps of the protocol are things that are valuable in what we do in hygiene, which is updating a patient's medical and dental history. It's about doing really good assessments. So knowing where they're at in their level of health or the level of disease, so that we can have really good conversations with them about recommendations for home, because the patient education is one of the most important things that we do for them in that appointment, so that they can start to improve upon their overall health. And then we actually start with a technology called airflow. And airflow uses a combination of warm water, it's 40 degrees, air, and a gentle powder called erythritol powder. It's 14 microns. And that's where a lot of the advancement has come with the technology, is this powder that was developed in 2013 by Dr. Marcel Donnet, who is a specialist in powder technology out of EMS. And this powder is actually safe to use on all the materials in the mouth, and then you can even use it on the tongue. It feels very soft. It's got a slight sweet taste, and we deliver that powder in a very comfortable way. We remove all of the biofilm, we call, which many patients may consider that plaque, and stain, and we actually do that at the beginning of the appointment versus going to that gritty toothpaste polish that we would do at the end. So this actually removes all of that stain, all of that plaque from the tooth surface right from the get-go in a very comfortable way. And then we would go into another step, which is called the perioflow, which will do that powder under the gum for patients who maybe have deeper pocketing, very comfortable again with the warm water. And then the ultrasonic that we use is a Piezon, which is a very unique technology from EMS that moves in a perfectly linear way. It also uses warm water. And one of the cool things about it has a built-in dynamic regulator, which means that the tip actually is intuitive. So when it comes into contact with the calculus or the tartar, many people refer it to, it actually will change the way it moves to make it more comfortable for the patient and easier on the clinician as well. So that's the bulk of where the technology comes in. But the whole protocol is about the clinician and the patient really working together for better outcomes.
Okay, excellent. Yeah, that's, I didn't know there was all those steps, even though I've got them, right? So
yeah, absolutely. And a lot of those steps are typically what you would be also getting with your traditional, but a lot of clinicians maybe struggle to find the time in their appointment because they're spending so much time with their traditional tools, essentially scraping off the bacteria and scraping off the buildup. That
makes me cringe a little bit.
It does when you say scraping, but that is the reality. And that was more time consuming. So we're really trying to make that debridement stage or the removal of all of that stuff easier on everybody. And then this really opens up the appointment time for clinicians to have more one-on-one face time with education. Maybe it's about incorporating scans for patients on a more regular basis, because we know with that technology, scans can tell you so much about the small changes that you're seeing in a patient's dentition over time, so we'll start to see if they have more recession or if they're having more wear on their teeth. That's about introducing things like a night guard, maybe, if they're grinding their teeth at night. So this is about everybody working together to support the patient and how we can make the appointment work differently for them.
Okay.
Yeah.
Awesome.
Yeah. So I guess for you, because you're coming and seeing this from a very different perspective, obviously you've had it as a patient. So what do you find really helps differentiate a practice in the competitive market?
Well, like I said before, I think one of the things is just having something different. Because if you have something you can talk about, then it sounds different in the marketplace, because there's so many people who are out there saying, "Hi, here we are, come to our place for no apparent reason," right? So if you have a good reason and something that is changing the way that you get hygiene, which everybody does, or at least is
Yes.
supposed to, it really does change the whole way that you can experience your dental visits. So, and the other thing I think that I had mentioned before is to be able to talk about something early. And one of the ways that I've seen that's been fairly effective is because GBT is not something that a lot of the general public really knows about yet. They're not out there searching on Google for it.
Mm-hmm.
And so we found some really good success in using things like Meta and social media ads to be able to push that message out there and expose people to that message, so that now they're being educated about it, and they're learning, oh, this is different. This is something that I didn't know about before. So we're actually able to let people know, hey, it could be better than what you have it right now. Or go and ask your dentist, because as we were talking to someone in our office about, they have GBT, they didn't even know it,
Yeah.
right? So yeah, I think the other thing that is nice about GBT, it's the type of thing that really speaks to like preventative dentistry. And I think people are really, they understand that, because they don't want to have the restorative dentistry, because that hurts, right? You got to get needles. You got to, there's all kinds of uncomfortable stuff involved in that. So I think if we can have a message that helps to build trust in that dental practice, because they're not just there to put a Band-Aid on things and fix the problems. They're there to solve the problems before they happen. Mm-hmm. And that's one of the things we found with GBT. A question that popped into my head is, how does, I guess if you were to compare the comfort level of GBT to the old ultrasonic and scaling, where would you put that, and how would you compare the two in the different aspects that you had just gone through?
Yeah. Gosh, I mean, that's an interesting question, because it's really hard to compare, because I think GBT just it's so different. It's so different. It's so next level. I mean, we know warm water is part of it, but it's the evolution of the powder. It's that concept behind, can we do more with technology and have that more minimally invasive, sort of comfortable experience for patients? I would say a lot of patients that have an ultrasonic, which is what now we've been using for many years to try and remove as much stuff as we can, it becomes so uncomfortable over time, and they really do dread it. But it's one of the better tools that hygienists have had that's easier for us, and did kind of help speed things on a little bit. But there's always this very fine line for clinicians where we want to do a really good, thorough job, but you also don't want to take a patient over the edge, where now that you've created a traumatic experience for them and they don't want to come back at all anymore. And I think there's a lot of patients that don't say anything. And I think if you were to survey them in terms of like, how do you like this part of your hygiene visit, if you're talking about an ultrasonic, I mean, I would suspect it would score really low, but many of them just come in and tolerate, because they just have never had anything else, and they think that this is really the only way that it can be done. And so for me, one of the biggest things I talk about with guided biofilm therapy is, not only is it they've designed it with light hand pieces, better ergonomics for clinicians, so it's easier on our bodies. But one of the big things we don't talk about in dentistry is the mental load that dealing with anxious patients, or patients that don't like coming to see you, that toll that it takes on you day after day after day. The most exhausting appointments are often the patients that are already stressed to be there. They're highly sensitive. You're walking sort of on eggshells with them through the whole appointment. And so they're like this. As a clinician, you're also like this. The moment that I was able to introduce a technology that I knew was going to be more comfortable, it gave me relaxation. And I found I was less exhausted at the end of the day. I was working really part-time towards like the end of where I was working clinically with the technology. And I would say, to do it traditionally, if someone were to say, hey, can you cover my shift on Friday? I probably would be a little like, oh, do I really want to? Because I was tired by the end of the week. But when we introduced GBT, I had so much more energy. I felt so much more passionate about my job. It had totally elevated, reignited my career. And I would have been much more likely to accept a day of doing GBT over the traditional. And that's what I think is so cool about the technology, is that we're really investing in everybody. It's a technology that is beneficial for the practice. It's beneficial for the patient, but it's beneficial for the clinician as well. So it's just, there's very few things that come onto the market that serve everybody kind of in the same way.
Yeah, so it's good for everybody.
Yeah. So I know for EMS, we're really passionate about education, but we're doing a lot of the education for the clinic so they understand why they want to invest in this technology. I guess for you, how do you think practices should educate their patients before they even walk through the doors? There's something they can do to help promote guided biofilm therapy.
I think there's several things that they can do. And the first one that a lot of clinics miss is communicating to their existing patients that they have GBT. I remember a story of a dentist that was one of the first people we worked with, and he said one of the worst things that happened to him, he had, not one of the worst things, one of the most embarrassing, I guess, was he ran into a patient who he hadn't seen in about a year and a half, and it was unusual because she always came in. And he said, "Hey, how you doing?" Blah, 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 and she's like, "Oh, I'm so embarrassed." She said, I went to another clinic because they had this technology. It wasn't GBT, it was something else. And he goes, "We've had that for 3 years," but he didn't tell them about it. And so I think that that's the very first thing that practices need to do, is do something through either social media or email marketing to get that message out to their patients. Because the last thing you want is them going to your competitor because they found out about GBT somewhere else. The next thing is have that information on your website. Have a dedicated page about GBT. There's enough information that you can definitely do that. And plus, when people start to search for information, they're going to show up in Google searches if they've got that information and it has been there for a while. And then the last thing I think is through social media and digital awareness ads, where you can put information out to people who maybe have no idea that it exists, and they're scrolling through their social media feed and they see this, "Oh, interesting. I didn't know that existed," right? So you're educating right from the beginning down the line, right through to the patients that you already have that maybe don't know about what you have to offer. So yeah, I think those would be the things that I would say are the best ways to educate. Of course, as a clinician, you should be talking about it in your practice to your patients as well.
Absolutely. I agree with that.
So a question for you, if I'm a dentist, and I'm thinking that, well, you know what, this isn't really going to improve my practice. It's only for the hygienist. What would you tell them? And how would you position it to say, yeah, you know what, this is something that's actually very good for your practice, outside of course, us being able to market it and have them get return on investment there?
Yeah, great question. It's so interesting because when we look at the majority of your patient population, I think over time you would start to see that your regular patients are spending more time with your hygienist than they are anywhere else. And I would say hygienists and maybe some dentists as well, we probably know more about our patients, their overall health, than a lot of their medical doctors do. And your hygienists are so knowledgeable in terms of many aspects of dentistry. They're there to really support the dental restorative side as well. And when we look at technology that we're investing into a practice, what's great about GBT and with airflow specifically is it is a technology that you are going to use on every patient every single time they come through the door. And again, when we look at historical, technologies that are introduced into dentistry, probably the last time they invested in something that is used for every patient every time is probably their dental chair, right? And if patients are spending the majority of their time with a hygienist, we really should be putting the best in their hands. right? We want to give them the tools that are going to give the patient the best experience, but also the hygienist longevity in their careers. We want them to stay with a practice because we know that's also really important to patients. Some patients will follow their hygienist, right? Because they do spend more time with them. So this is about investing in your whole team, right? I think one of the most important things, again, you want to give your hygienist time to be talking to their patients about different treatments that can be done. I find one of the patient populations that I spent a lot of time talking with were patients that were starting to go into retirement because their benefits start to change. And I would start to introduce them into maybe some potential treatment options that they should consider before they get into retirement. So almost like a treatment planning so that they could maximize their benefits, right? So if we were talking about something like a crown or an implant, okay, you're thinking about retiring in 5 years. Let's look at some treatment that we've been talking about, that we've been waiting on, and let's maybe plan this out over the next 5 years because we don't want you to get to a point where all of a sudden you've retired, your benefits have changed, and now it's a much more bigger financial impact to you to do this treatment. And I think hygienists are really valuable in that role to talk to patients, and patients trust us. Sometimes a dentist will come in and tell them something, and they'll immediately ask us after, what do you think about that? And so we are here to work together for the best outcomes for the patient.
So you're saying that a hygienist will typically, when using the GBT, will have more time to be able to talk to the patients about those other things.
Yeah.
So that's definitely a benefit to the practice because often it's in and out and nobody talks to them about anything, right?
Exactly. And patients need to know that's really the foundation of, and patients need to understand what we're recommending to them, and we have to educate them. And that's the most important thing. There's a quote out there that says there's very little value in actually what we do in dentistry without patient education. Because if they're seeing me 3-4 times a year, what they do at home is actually more valuable, right? But they need to know what to do at home to make sure that what I'm doing in practice is also is successful and effective.
Okay, excellent.
So what marketing mistakes should practices avoid when promoting things like guided biofilm therapy or maybe other specialty services?
With something like GBT that is relatively unknown in the general public, I think a big mistake is to put a whole bunch of money into search advertising. The reason is because there's not a lot of people searching for it. And so, if you're putting all of your eggs in that basket, you're probably going to be a little bit disappointed because, 5 years from now, absolutely, because it's going to become more well-known, and as more practices come on, everybody's going to be searching for it because they're going to know, I don't want to go there anymore because they don't have it, right? As far as mistakes, the other thing I would say is not tracking everything that you do, because if you're not tracking it, you don't know what's working and what's not.
Yeah.
So something we haven't touched on, and it's my favorite part of the whole GBT experience, is the disclosing solution.
Yes.
And it's my favorite, not just because it's cool when I go in there and I get to see the things that I've missed, but it's one of the best things for marketing. So tell me a little bit about that and how that fits in.
Absolutely. So disclosing solutions been around actually since 1914, if you can believe it or not. And we learn about it in school, and we're meant to use it, and again, as an educational tool. Disclosing solution is a dye, and many of us remember chewing on those tablets maybe as children.
I too, yeah.
And it would color the plaque so that you could see where the plaque was, and you could then brush it off, or you would brush your teeth and chew the tablet and see where you kind of missed. We move away from that a lot in private practice. Maybe we do it on children still, but with adults, we kind of move away. We're sort of assuming that you know how to brush your teeth. And also with the tools that we had, if I put that purple stuff everywhere and your teeth are purple everywhere, when we think of our traditional tools, it's very time consuming to get off. And we also know that in dentistry, it's important to give clinicians enough time to spend with patients, but patients also don't want to be there for 3 hours getting their teeth cleaned. They reserve that for in school. We spend 3 hours with a patient, but they're, usually a certain senior population that they're happy to come for a morning and get that treatment, but most patients don't want to be there for that long. So the disclosing solution is actually meant to be not only a tool for the patient so that we can show them and educate them on where they're missing, is actually our map or our guide to make sure that as a clinician, I'm removing all the biofilm there. That also helps us to be more efficient, because if I don't see it, I'm probably going to either spend too much time in one area or not enough time in one area. And so this is about just really increasing that thoroughness. And would you say, as a patient, has it changed since you've done guided biofilm therapy? Did it help you improve your habits at home?
Absolutely.
The solution?
Yes, because I'm so good at brushing and flossing, right? And I go in and they put this on and I'm like, well, I guess I'm not as good as I thought. So it has changed my habits, because every time I pick up my toothbrush now, I think about where my hygienist showed me that I was missing, and I focus, or at least make sure I hit those parts where I was missing before. So yeah, absolutely. It makes a big difference.
Yeah, it was really eye-opening actually for me as a clinician as well, because I didn't realize in many cases that I thought a patient maybe was doing quite well, but when I put the disclosing solution on, yes, they were maybe overall doing a good job, but they really had these sort of air pockets or areas that had quite a bit of that purple or that pink coloring. And I was really able to give them that individual patient experience. This is what you need to do. And I think that's really important too, is that every patient is different and they're different every day. So for clinicians, we want to make sure that we're also offering that to them, these different options. And I think the disclosing solution really helps with that, for a patient to see what we're not just throwing floss in their face or these other tools in their face. There's a reason behind it, or there's a reason why I'm recommending this tool to you specifically, because you are an individual and this is what you need to clean this area better.
Yeah, it's one of the things that we enjoy using in the marketing as well, because our big challenge is when people are looking at social media, they're scrolling, they need something to stop that scroll. And seeing somebody with purple teeth, bam, they're stopped. Like, what is this? So when I first learned about it, I'm like, yeah, this sounds like a good thing to market.
I think it triggers a lot of patients' like childhood memories too.
Oh yeah.
And in an interesting way, I don't think patients, I think a lot of practices are worried that their adult population is going to be like, no, you're not doing that on me. But I actually found adults were very excited to have it. It was, again, something.
It's nostalgic.
Yeah, it was nostalgic. Exactly. I say GBT is kind of a marriage of some like really older foundational things that we know are super valuable, and just marrying it with kind of new technology to make it better and more efficient.
Yeah.
So for you, obviously you're seeing GBT grow out there. So what can you do to help a practice stand out if there is multiple clinics that are offering this service or GBT in one area?
The first thing I would say to that is that a rising tide lifts all ships. So if you're seeing a lot of marketing in your area for GBT, it's going to help you too, because it's going to have your patients asking. But typically that doesn't happen. What happens is nobody's saying anything about it. And so if you're the one who decides, hey, I'm gonna market this, you're the one who gets the business, because nobody else is talking about it. And I think I mentioned it before, the first person to talk about it usually wins, right? So if GBT is the only thing that differentiates your practice, then you need to start looking at the rest of your practice, because you should have other things that differentiate, and including that in the mix really positions you as a premium service. And I think a lot of people are looking for that premium service, and nobody's talking about that out there, right? So I think that's what I would say to people. Don't be afraid to get it because everybody else has got it. You're going to need to get it anyway.
Yeah.
Right?
Would you say that guided biofilm therapy is one of the first things that's been kind of introduced into the industry that is highly marketable for the hygiene side of a practice versus tools that dentists can purchase for?
Absolutely. I have been marketing dental practices for over 20 years, and this is the first time we've been able to market anything with hygiene. So that tells a story, and I'm sure it's been longer than that. So yeah, we've, it's always about, clear aligners or in-office crowns or all of the other fancy technology that dentists have these days, but it's never been anything about hygiene. So other than, hey, you need to come in and get your teeth cleaned every 3 to 6 months for preventative reasons. So yeah.
And for you, obviously, you have a lot of experience in dental marketing. I guess, how do you see that? I'm asking off the book here. How do you see hygiene being such a valuable part of marketing a dental clinic? I guess in terms of even like patient retention, you're talking about tracking patients and things like that. Because I think a lot of patients don't realize, or practices don't realize, the value of hygiene within their own practice.
I think that if you don't realize the value of hygiene, you need to really take a look at it, because hygiene feeds the entire rest of your practice. Often we have practices that say, we want to market dental implants. Well, yes, you can do that. But if you take a look at where dental implants come from, it's usually your existing patients who end up needing to replace a tooth, and then you do that. Often people who are going to call you about dental implants is just because they got a shock when their dentist told them how much it was going to cost, and they want to make sure that they're not overcharging them. So most of the other services come from hygiene, and everybody knows they need dental hygiene or to go in for their regular hygiene appointments. So it's not something you have to convince them that they should, because they know. I mean, it's not like, we're 50 years ago when people didn't know that. So I think that it's a mistake to ignore the fact that hygiene feeds your practice. The other thing that surprised me as I was talking to dental offices is that the hygiene program is actually a very, very high part of their revenue, because every patient needs it. So, if you're discrediting or not really discrediting, but ignoring the fact that that's going to be a very large part of your revenue, it's important to have something like GBT to make sure that those people are sticking around too. One of the complaints I hear all the time is, there's a shortage of hygienists out there. Well, you know what? If you do something to keep the hygienists you have, you're not going to be complaining about a shortage of hygienists, because they're going to stick around, right? So, yeah, I think definitely hygiene is a pretty important part of it. Chelsey, we've covered a lot of stuff here, and I'm hoping we haven't confused people about GBT. But if there was a dental practice owner who has been considering GBT and is sort of on the fence, what would you tell them?
Yeah, I think that at the end of the day, GBT isn't going anywhere. This really is the path forward for biofilm management, patient care. And at the end of the day, my husband told me when I first started this job, one of the things that sticks with me is that we've stopped investing in people. And I think that that's what I love about GBT, is that this is really investing in the people. That's investing in the patients. It's investing in your team, your clinicians, and it is investing in your practice. And I think that that goes a long way. So often technology, again, we're just looking at it as a machine. And I think that this is so much more than a machine. And patients will thank you for it. When I first introduced it into our practice, I remember I had one patient and I thought it was just one of the greatest things. He turned to the dentist and he thanked him. And he said, "Thank you. Thank you for getting this, not only for me, but thank you for getting it for your hygienists." And that's really what it is about, is that how can we just make this better for everybody? And I'm here to answer questions. I think it's really important that offices get all of their questions answered and able to understand what investing or integrating the technology looks like for their practice, because we also know every practice is unique out there and it might look a little bit different in how we introduce it into them. And it's important they understand that before they go ahead with this investment. And that's where our role is to help support them through that. And then obviously we do a lot of education throughout, and then we do the education after as well to make sure that they are getting successful outcomes with this investment.
So what would be the next steps then? How would they get a hold of you? What would happen after that? Just tell me how they would
Next steps. Yeah. So we do it in a few different ways. We have GBT experts across the globe and across North America. Obviously, this may be viewed by people all over. So the easiest way probably would be to go to emsdental.com and you can book a demo. And that would align you with one of the experts in your area. Generally, what we do is something like a virtual presentation or a phone call first to get to know the office, see where they're at, try to understand maybe where some of their challenges are right now, maybe how GBT can help with solutions to their challenges and help them understand the GBT protocol as well as the technology behind it. And then we would schedule maybe an in-practice demo. So they get to see the technology in person, they get to try it out, see what it feels like. We can align them with other dentists or specialists across North America that have, integrated GBT for several years now, and they can share their experiences with it. And I think that's one of the things I love most about GBT is there's so many practitioners out there that are very passionate about it, that want to continue to share it. So often, I know you probably feel this, like you said, they want to keep some of this information close to home, but they really want to start to see this paradigm shift in hygiene across the globe. And so they're excited to share this with other dentists and other specialists out there and say, hey, you should look at this. This has really changed our life. It's changed our patient's life. And so there's lots of ways that we can share some information with practices. But I would say go to emsdental.com first and you can book a demo. And that's a great way to start.
Awesome. Well, thank you, Chelsey. I completely agree with you. We've had the opportunity to go to a couple of EMS events and everybody's raving about it. So thank you very much for spending some time with us today. And I know that lots of people who are watching this are probably going to end up with you in their practice. So
awesome. Well, thank you for having me today. It's
I appreciate it.
Learning from you guys as well about kind of the marketing side of dentistry too. So I've learned a lot from you
Awesome.
the last few months.
Well, hopefully we haven't confused any of you today, and you've learned a lot about GBT, something that I didn't know anything about up until a few years ago when one of our clients came to us with a new technology that they wanted to market. So if you're thinking about getting GBT or you already have it and you would like to expand that in your practice, give us a call. Go to smileshopdentalmarketing.com and we'd be happy to show you what we're doing for other practices and show you how you can get ROI with this service. Thanks a lot. See you guys later.